Dachau, 29 April 1945. Northwest of Munich, U.S. 7th Army units reached the Dachau concentration camp and found roughly 30,000 prisoners alive. Archival film compiled by the U.S. Holocaust Memorial Museum shows soldiers feeding and disinfecting survivors within hours, a verified contrast to what inmates expected from uniformed men carrying rifles. At the same time, U.S. soldiers routinely carried emergency chocolate rations. The quartermaster designed 4-ounce field ration D and, from 1943, the heat-resistant tropical bar. Hershey's wartime output scaled to approximately 24 million bars per week by late 1945, with over 3 billion ration units produced during the war. A logistical base for thousands of small encounters, civilians later remembered. The same command that enforced a strict no-fraternization policy in spring 1945 officially lifted the ban with children on 11 June 1945, a policy turn that helps explain why a candy bar became a recurrent documented image of the first post-Nazi months. A Signal Corps cameraman pans past U.S. medics and military police directing columns of emaciated prisoners toward delousing and feeding points at Dachau. A typed operations sheet lies on an officer's clipboard. The date, 29 April 1945. The place, Bavaria, northwest of Munich. Prisoners expected shackles. Film and official captions show feeding, disinfecting, and registration in the first hours instead. U.S. 7th Army elements, the 42nd and 45th Infantry Divisions, with 20th Armored Division attachments, executed the entry. Civil affairs, military government, and the U.S. Army Medical Department took immediate control of sanitation and care. The 1929 Geneva Convention required humane treatment of prisoners of war, adequate rations, and medical care. Supreme Headquarters Allied Expeditionary Force directives extended responsibilities to civilians and displaced persons encountered in liberated areas. Chlorinated delousing, isolation wards, and controlled feeding with field kitchens are visible in Dachau footage and align with Army Medical Department doctrine. The U.S. Holocaust Memorial Museum's caption confirms, U.S. personnel moved to feed and disinfect survivors. The same command system that planned combat phases now directed epidemics control and ration issuance, determining who ate, how much, and when. 3 U.S. divisions converged on Dachau and found more than 30,000 prisoners. The first orders emphasized sanitation, registration, and food, not reprisals. Within days, the same apparatus would manage millions more: surrendered German soldiers, liberated slave laborers, concentration camp survivors, and displaced civilians across a shattered continent. The policy was clear, the scale was unprecedented. A quartermaster inspector opens a K-ration carton. Inside, biscuits, a candy bar, gum, and coffee powder. Another crate holds field ration D bars, stamped 600 calories. Civilians imagined soldiers carried only weapons. In reality, GI loadouts routinely included candy and gum. Quartermaster histories list confections across C and K rations. Field ration D, 4 ounces, approximately 600 kilocalories, was specified to taste a little better than a boiled potato, withstand heat, and resist crumbling. The design was deliberate. Captain Paul Logan's directive to Hershey chief chemist Sam Hinkle: make it unpalatable enough that troops would save it for emergencies, yet edible enough to sustain life. Technology defined the ration. Field ration D composition: chocolate, sugar, dry milk, cacao fat, oat flour, approximately 600 kilocalories per bar. K-ration accessory packs: gum, confections, sugar tablets, cigarettes in a separate pack, tropical bars, introduced in 1943 for high-heat climates. Hershey's specification notes underscored the goal: highly concentrated, conveniently pocket-size, and able to withstand heat. Because chocolate and gum were compact, non-perishable, and always on hand, they appeared in countless first contacts, sometimes before medical guidance could be applied. By late 1945, Hershey was turning out approximately 24 million ration bars per week. Production ramped from 100,000 bars per day in 1939 to this industrial scale by war's end. Total wartime output exceeded 3 billion ration units between 1940 and 1945. One reason a candy bar was often the first digestible thing many civilians saw: it was always there, in every soldier's kit, across every theater. A field kitchen ladles thin stew, medics post intake logs, military police cordon off areas for delousing. Survivors feared punitive treatment. Instead, feeding and delousing were immediate priorities at Dachau. Meanwhile, in occupied towns, non-fraternization orders technically barred casual contact, yet GIs were already handing chocolate and gum to children. U.S. Holocaust Memorial Museum film captions confirm the sequence. National World War II Museum analysis notes the 11 June 1945 relaxation for children and further easing in July. Units of the 42nd, 45th, and 20th Armored Divisions are named in Liberator recognitions and official commemorations. Individual soldiers' names appear in after-action reports and unit histories preserved at the Eisenhower Presidential Library. Organized relief actions, registration, isolation, controlled feeding, reduced immediate mortality risks, and stabilized camps for subsequent displaced persons administration. The policy still said no fraternization. The practice on the ground, especially with children, was already shifting by early summer 1945. Within weeks, the same army would process millions of German prisoners of war. The logistics officer who coordinated Dachau's first meal deliveries would soon face a medical crisis measured not in thousands but in hundreds of thousands of hospital admissions across transient prisoner enclosures from the Rhine to Bavaria. The candy bar in a GI's pocket was never policy. It was ubiquity meeting human instinct. But the system behind liberation, the field kitchens, the delousing stations, the ration scales, the medical protocols, that was policy, executed at industrial scale. Dachau was day one. The crisis had only begun. A logistics officer reviews a map marked with prisoner of war enclosures. A typed daily strength report shows intakes spiking after the Rhine crossing. Plans anticipated heavy captures. Actual tallies were extraordinary. U.S. forces in March through May 1945 processed well over 2 million prisoners in the field, requiring transient enclosures with water, latrines, and guarded perimeters. From D-Day to 30 April 1945, Western allies took more than 2.8 million German prisoners of war, including approximately 1.5 million in April alone. The Army Medical Department's advanced section later reported an unprecedented medical burden driven largely by German prisoners and displaced persons. Technology and infrastructure scaled rapidly. Barbed wire prisoner enclosures, water purification units, mass latrines, field kitchens for basic rations, theater-level evacuation chains to hospitals. The Army Medical Department Center of History and Heritage documents the crisis in stark terms. In the 6 weeks ending 15 June 1945, advanced section hospital admissions totaled 345,324. The disease death rate among patients was 20.5 times that of U.S. troops in the same areas. Overwhelming intakes turned medical service into a primary line of operation. Communicable disease control, triage, and controlled feeding overtook combat as the daily task in many sectors. A single statistic captures the scale. Admissions in 6 weeks eclipsed combat months, numbers that forced doctrine to the fore. Numbers that required industrial food systems, not improvisation. The prisoners kept coming, the hospitals kept filling, and the ration system, designed to feed armies in the field, now fed defeated armies, starved civilians, and liberated slaves behind barbed wire. A ward officer signs orders limiting rations for severely malnourished patients. A diet sheet lists step-up calorie targets. Popular instinct was to feed freely. Medical knowledge warned otherwise. Contemporary and subsequent analyses describe refeeding syndrome, fluid and electrolyte shifts, including hypophosphatemia and heart failure, when starved patients are fed too quickly. World War II experiences among prisoners of war informed this caution. The Royal Society of Medicine convened discussions on the physiology and treatment of starvation as early as 29 May 1945. Later medical literature confirms refeeding syndrome was first described in Far East prisoners of war after the Second World War. Prevention requires gradual feeding and electrolyte monitoring. Technology and guidance evolved from field experience. Controlled diets, vitamin supplementation, cautious carbohydrate introduction, close monitoring. Medics were instructed to prioritize fluids, infection control, and staged caloric increases over ad hoc distribution of sweets. This medical reality explains why candy could appear in scenes, yet not substitute for systematic refeeding protocols. At advanced section enclosures, the problem was not symbolic, it was biological. 345,000 admissions in 6 weeks. Disease death rates exceeding 20 times the rate among healthy U.S. troops. Diarrhea and dysentery alone, more than 81,000 cases in May 1945. In liberation footage, a candy bar is visible. In the ward orders, it is not a diet. Medicine dictated the difference. The chocolate in a soldier's pocket could offer comfort, a moment of kindness, but survival required broths, staged calories, sanitation, and time. The difference between a gift and a treatment plan was measured in phosphate levels and mortality tables. A conveyor at Hershey runs uninterrupted. Pallets labeled for overseas shipment moved to port. Acts of kindness appeared spontaneous. Supply was industrial. Hershey records show approximately 3 billion ration units produced during the war and approximately 24 million bars per week by late 1945, ranging from field ration D to tropical bars, precisely engineered for caloric density and durability. Technology defined production, heat-resistant formulations, waxed, laminated packaging, compact weight and volume per 600 kilocalories. Hershey Archives quotes the quartermaster specification goal. D bars should be highly concentrated, pocket size, and able to withstand heat. The edible compromise taste only slightly better than a boiled potato. This deliberate unpalatability ensured soldiers would not consume emergency rations casually. Production scaled across the war years. 1939, 100,000 bars per day. 1943, tropical bar introduction for Pacific and Mediterranean theaters. Late 1945, 24 million bars per week. Army food purchases in 1944 were approximately 80% greater than 1943. 1945 plans called for an additional 20% increase over 1944 levels. The Quartermaster Corps procured not only for U.S. troops, but increasingly for prisoners of war, displaced persons, and civilians under American responsibility. This throughput ensured that chocolate and gum were ubiquitous in GI kit and in mass rations for prisoners and displaced persons, supplementing, not replacing, controlled feeding. One factory's weekly output equaled millions of first tastes, but always within a larger rationing plan. The candy bar was visible, memorable, symbolic. Behind it, procurement tables, shipping manifests, calorie calculations, and medical oversight that determined survival at scale. A civil affairs officer signs a camp registry. A wall chart lists camp numbers and average daily calories. The public saw liberation as an endpoint. Administration had only begun. Allied authorities classified displaced persons and, by late 1945 through 1947, operated hundreds of camps. The Historisches Lexikon Bayerns documents 416 displaced persons camps in the U.S. zone and 272 in the British zone by June 1947. By 1 July 1947, there were 611,469 displaced persons in Germany. Jewish displaced persons population in Europe stabilized around 250,000 by late 1946 through 1947. The U.S. Holocaust Memorial Museum and Yad Vashem detailed distributions: 185,000 in Germany, 45,000 in Austria, 20,000 in Italy. Calorie scales became policy instruments. Historisches Lexikon Bayerns notes displaced persons were usually entitled to at least 2,000 kilocalories per day, exceeding local German civilian scales. In many locales, implementation varied with supply, classification, and ration scales tied relief to policy, not ad hoc charity, tracking bodies and calories as operational metrics. By mid-1947, the U.S. zone ran 416 camps. Relief measured in sites, headcounts, and calories, not anecdotes. Each camp required administration, registration cards, medical screening, food distribution points, sanitation facilities, security perimeters. Each displaced person required documentation: nationality, family status, destination preference, work skills, health status. The system was vast, imperfect, and unprecedented. It moved hundreds of thousands toward resettlement over years, sustained by the same logistical networks that had moved armies across Europe. The chocolate bar handed through a fence was real. So was the bureaucracy that determined whether that fence surrounded a temporary shelter or a permanent limbo. A bulletin board repeats non-fraternization orders. Military police cite violations. Nearby, a GI quietly drops sticks of gum into a child's hand. Policy forbade contact. Practice eroded it. The National World War II Museum summarizes the sequence. 11 June 1945, Eisenhower lifted the ban regarding children. July allowed limited conversations with adults. Contemporary photos show GIs sharing candy and cigarettes with civilians after VE Day. Signal Corps photographs document the pattern. Caption: Soldier gives candy to 2 Italian children. Anzio, 30. January 1944. Another Christmas party, candy and gum for children, 25 December 1944. A German civilian memoir published by U.S. Army Europe recalls, many soldiers gave candy, chocolate, and bubble gum to us children. Easing the ban reflected both discipline realities and a strategic choice. Controlled human contact supported stabilization and information flow, while children became the first sanctioned bridge between occupiers and occupied. On paper, no smiles. In practice, by June through July, candy for kids, talk on the street, policy catching up to reality. The shift was gradual, uneven, and pragmatic. Commanders balanced security concerns, morale needs, and the recognition that isolation policies were unenforceable at the personal level. By summer 1945, the question was no longer whether contact would occur, but how to channel it towards stabilization goals. The candy bar and the stick of gum became tools of soft power, unplanned but effective. They cost little, weighed nothing, and crossed language barriers instantly. They turned children into ambassadors and GIs into symbols of a different kind of occupier. But behind every candy bar, a supply chain. Behind every smile, a policy debate. Behind every photograph, a system deciding who ate, how much, and when. A staff conference reviews the Harrison Report, and Eisenhower's replies. Orders go out to separate Jewish displaced persons and raise rations. Reports condemned conditions. Command responded with structural changes. The Harrison Report, delivered in August 1945, criticized displaced persons' camp conditions and urged separate Jewish facilities. President Truman pressed Eisenhower to act. Eisenhower's September through October 1945 correspondence details steps taken, including rations policy and camp reorganization. Eisenhower to Truman, 8 October 1945. I have recently raised the daily calorie food value per person for ordinary displaced persons to 2,300 and for racial and religious groups toward whom our obligations are greater to 2,500. The administrative shift, separate Jewish displaced persons camps, calorie increases, inspection tours, moved relief from ad hoc to measured programs. Numbers drove policy. By October 1945, Jewish displaced persons in the U.S. zone exceeded 100,000. By end 1946, the total stabilized near 250,000 across all zones. The need for separate administration became undeniable. Different repatriation prospects, different trauma histories, different community structures. Calorie increases reflected both moral pressure and practical reality. Displaced persons could not rebuild lives on starvation rations. German civilian rations in many areas remained below 1,500 kilocalories per day. Displaced persons' rations, now officially 2,000. 300 to 2,500 kilocalories, signaled priority status and legal obligation. A candy bar made headlines. A 2,300 to 2,500 kilocalorie order changed outcomes. The shift was documented, measured, and enforced through theater-wide directives. Relief transitioned from emergency improvisation to systematic administration, from military occupation duty to international refugee management. The system's visibility changed. The system's scale remained extraordinary. A ward census board shows soaring patient loads. A typed return lists communicable disease categories and death rates. Liberation brought a surge not only of gratitude but of patience. Army Medical Department's Advanced Section recorded 345,324 admissions in 6 weeks, ending 15 June 1945, with disease death rates 20.5 times U.S. troop rates and two-thirds of patients being non-U.S. German prisoners of war, displaced persons, civilians. Technology and practice scaled to meet the crisis. Isolation wards, typhus control through delousing with DDT where used, dysentery treatment, staged refeeding, and mass sanitation engineering. Army Medical Department Center of History and Heritage documents the breakdown. German prisoners of war accounted for the bulk of non-U.S. admissions. Disease death rate was 20.5 times that of American troops. Diarrhea and dysentery alone, more than 81,000 cases in May 1945. Typhus, tuberculosis, malnutrition, and a catalogue of communicable diseases swept through overcrowded enclosures faster than medical personnel could contain them. These metrics justified controlled feeding protocols and prioritized sanitation over generous but unsafe food distribution. In 6 weeks, admissions passed 345,000, numbers that converted compassion into doctrine. The medical crisis proved that relief required more than good intentions. It required water purification, latrine construction, delousing capacity, pharmaceutical supplies, trained personnel, and systematic calorie management. It required transforming combat logistics into public health operations overnight. Candy bars could not treat dysentery, chocolate could not cure tuberculosis, gum could not prevent typhus. The soldiers who handed out sweets were the same soldiers who dug latrines, sprayed delousing powder, and enforced quarantine lines. The visible act of kindness rested on invisible infrastructure. The chocolate bar was a symbol. The system was survival. A bill of lading lists ration D bars by the million. Unit supply sergeants sign for tropical bars and K-ration candy and gum. Testimony often remembers chocolate first. The explanation is logistical. Compact, heat-resistant, high-calorie items were standard issue. Hershey output reached approximately 24 million bars per week by late 1945 and approximately 3 billion wartime units total. Quartermaster histories confirm confections and gum across C and K rations. 105 million K rations were procured in 1944 alone. Hershey specification and production figures, Quartermaster historical background listing gum and candy components across ration types. Ubiquity plus medical caution explains scenes at the wire. A candy bar could be the first safe bite, but the diet came from kitchen lines and hospital menus. Industrial food power made kindness portable, and policy kept it controlled. Consider the mathematics. 3 billion ration units divided across approximately 16 million U.S. service members over 5 years equals approximately 187 units per person. Add distribution to prisoners of war and displaced persons, and the number drops, but remains pervasive. Every unit carried chocolate, every supply dump stocked it, every field kitchen supplemented hot meals with sweet rations. The result? Chocolate became the universal American calling card, present at every point of contact between U.S. forces and European civilians. From Normandy to Bavaria, from Sicily to Austria, from liberation to occupation, the pattern repeated, not because of orders, but because of ubiquity. The system did not plan for chocolate diplomacy. The system planned for caloric density, heat resistance, and emergency nutrition. Diplomacy was the unintended consequence of industrial food power meeting human need. Behind every remembered candy bar, a factory, a procurement office, a transport ship, a supply depot, a quartermaster sergeant, and a policy framework that turned industrial output into individual moments. United Nations Relief and Rehabilitation Administration and International Refugee Organization staff issue ration cards. A statistical table lists camp counts and calorie scales. By June 1947, the U.S. zone operated 416 displaced persons camps. British zone, 272. On 1 July 1947, Germany hosted 611,469 displaced persons. U.S. zone held 336,700. Jewish displaced persons numbered approximately 250,000 by end 1946, concentrated 185,000 in Germany, 45,000 in Austria, 20,000 in Italy. Calorie scales targeted at least 2,000 kilocalories per day, rising after Eisenhower's 2,300 and 2,500 kilocalorie order in October 1945. Historisches Lexikon Bayern's enumeration of camps and calorie entitlements, U.S. Holocaust Memorial Museum and Yad Vashem counts, Eisenhower's October 1945 letter confirming raised rations. Relief transitioned from military emergency to international administration, United Nations Relief and Rehabilitation Administration, then International Refugee Organization, with calories, camp rosters, and shipping tonnage as key levers. The symbol was a candy bar. The system was measured in hundreds of camps and thousands of daily ration cards. Each camp became a small city. Administration offices, medical clinics, schools, workshops, religious centers, police forces. Each required inputs, food tonnage, fuel for heating and cooking, medical supplies, clothing, blankets, lumber for repairs, paper for documentation. The International Refugee Organization assumed responsibility from the military in July 1947, inheriting a system that would operate for years, gradually shrinking as resettlement opportunities opened, to the United States under the Displaced Persons Act of 1948, to Palestine, and then Israel, to Canada, Australia, and Latin America. The last camps closed in the early 1950s. The last displaced persons found homes or remained in place, no longer displaced, but resettled. A final card file shows a displaced persons camp closed. A demobilized GI folds a Hershey wrapper saved from 1945 Dachau. Liberation by elements of the 42nd, 45th, and 20th Armored Divisions. Approximately 32,000 prisoners on site. Film shows feeding and delousing within hours. Medical load, 345,324 admissions in 6 weeks to advanced section, 20.5 times disease death rate versus U.S. troops. Production and logistics, approximately 3 billion ration units, approximately 24 million per week by late 1945. Rations embedded candy and gum by design. Administration, displaced persons camps, 416 in U.S. zone by June 1947. Jewish displaced persons population, approximately 250,000. Calorie scales at least 2,000, raised by order to 2,300 and 2,500 in October 1945. Archival closing line documented. I have recently raised the daily calorie food value to 2,300 and to 2,500. Dwight D. Eisenhower to President Truman, 8 October 1945. Final marker. On 29 April 1945, U.S. units liberated approximately 32,000 prisoners at Dachau. The first hours were defined by registration, delousing, and feeding. The image of a GI handing a candy bar to a child is verified in wartime photographs and civilian testimony. Anzio, Allied military government Christmas parties, post-war German recollections. The system behind it comprised quartermaster procurement, advanced section and communication zone sanitation and feeding lines, displaced persons camp administration, and calorie policy documented at the highest command level. The candy bar was never the policy, it was the visible tip of an industrial and administrative apparatus that chose discipline, calories, and documentation over vengeance. The final impact is measurable. More than 2.8 million prisoners of war processed in the West by 30 April 1945, 345,000 hospital admissions in 6 weeks, over 3 billion ration units produced, 416 displaced persons camps in the U.S. zone by 1947. History remembers the chocolate, the archives record the system, both are true, both matter. The factories that made the chocolate also made the rations that fed millions. The soldiers who handed out candy also built the camps, dug the latrines, and enforced the quarantines. The commanders who raised calorie targets also managed the largest refugee crisis in modern history. The sweetness was real, so was the structure. The kindness was genuine, so was the scale. Between liberation and resettlement, 2 years, 400 camps, hundreds of thousands of lives sustained by measured relief. The candy bar opened the relationship. The system kept people alive. That is the accounting, that is the history.